This is Dr. Amitabh Chak, Professor of Medicine at University Hospital's Cleveland Medical Center. And my name is Peter Lee. I was his mentee as an Advanced Endoscopy Fellow for 2 years and graduated fellowship last year. And I'm currently a junior faculty at University of Pennsylvania.
And the reason I asked Peter to do this is we've just instituted a 2-year advanced endoscopy program, and Peter is our first graduate of the Advanced Endoscopy Fellowship. This is something that's near and dear to my heart. We've been training advanced endoscopists and endoscopy fellows for over 20 years. Inherited a program from Michael Sivak, who some of you may know, and who is one of our masters in video GIE. And learned first from Michael, and now I'm trying to train others to become advanced endoscopists and to become academic endoscopists.
So on that note, in your opinion, in an age where productivity and RVUs are so emphasized, why should a fellow in GI be strongly considering a career in academic medicine?
Start with the soft stuff first, why don't you? It really has become a challenge for those of us who are in academics, and you can't hide it. There's more and more stress into going into academics, as you know. But as you know, you had a passion for going into academics. And for those who are passionate about the academic practice, where you enjoy innovating or you enjoy teaching and you enjoy taking care of technically challenging cases, there has to be something that calls out for you that overcomes that stress of having to do more RVUs or people pulling you into different directions, and while you're trying to do what you went into academics for. And that's part of something you have to figure out for yourself, whether that fits or doesn't fit. Economics have become challenging. Chairs want you to work harder so they can balance their budget. The chair of the chair wants you to work harder so you can balance your budget. They want you to generate more than you're capable of generating. But one of the advices is to figure out how to protect yourself in that jungle.
So for a graduating fellow going on a job interview at an academic center, what advice do you have for him?
So first, look at your own program and talk to the people who are mentoring you. Talk to them about different programs, what the strengths are, what the weaknesses are. Every program is different, but all academic centers have a set of guidelines, and you need to look at those guidelines at those places in terms of what will it take to get you promoted, whether there is a tenure track and a non-tenure track, what those tracks involve, what the requirements are for becoming an associate professor, what's expected of you in terms of your clinical volume, what's expected of you in terms of your teaching, what's expected from you in terms of your research. And different programs will emphasize different things, and they will have different tracks. So look at the job that they want you for. They're looking for a particular individual to fit a certain need, and you have to decide whether what you want to do fits that need. Don't try to be a square peg in a round hole, or a round peg in a square hole, whatever the metaphor is, but find out from your own mentors before you go as to what the questions are to ask, and when you go there, really look at the program in terms of what their policies and guidelines are.
So another common experience, or actually statement that I hear from more senior advanced endoscopists is that the field is saturated in academic advanced endoscopy departments around the country. What advice do you have for advanced endoscopy fellows looking to make themselves more competitive in this market?
So there's certain areas of endoscopy where there probably are enough people doing it, but one can always use new blood with new ideas. And endoscopy is not a static field. You know, it used to be advanced endoscopy was ZRCP, then endoscopic ultrasound came along, then small bowel endoscopy came along, then endoscopic therapy of Barrett's came along. So over the years, every few years, there's a new innovation. Bariatric endoscopy is a new field now. Anti-reflex therapy is being investigated. So find an area that is new, that you enjoy, and create a niche. Yeah, it's a little more harder than it was, say, 25 years ago when I started, but there's still openings for the right people, and there are academic centers who are looking for new technologies, new techniques, and someone who has the passion to investigate or passion to teach, in addition to providing good care for their patients.
I remember before I committed to advanced endoscopy, thinking to myself, am I ready to deal with the complications that come naturally with doing a highly invasive procedure? Now, for those trainees that are on the fence about whether they're ready to commit to a career in advanced endoscopy, what is your advice to them in terms of the benefit of pursuing a career in advanced endoscopy?
Yeah, it's a very challenging area that we don't teach very well during regular fellowship or even during advanced endoscopy. If you're in any field of medicine, particularly in a procedural field and a field that involves doing high-risk procedures, you are going to have complications. That's just the nature of what we do. What we don't teach our fellows and trainees when they're practicing is how you deal with those, both emotionally and medically. When a complication happens and you're a fellow, the attending is there, and the attending is the person responsible for it. When you go out on your own and you encounter a complication, the first thing you have to do is tell yourself that this is part of the practice. And you want to blame yourself and you want to second guess yourself, but that's the time where you have to think of the patient, and you have to take a step back and start talking to the patient and the patient family, and take a calm breath and figure out how you're going to take care of the complication that's happened. And there are going to be times where something is going to go awry, and it's okay to go through that process emotionally and learn how to, and you have to go back and think that you were doing it with the best interest of trying to take care of those patients.
Yeah, I remember as a fellow, I think the biggest lesson I learned from you is just learning to walk with the patient through the period when they have a complication, and it was a very hard thing for me to overcome the fear of facing the patient after the complication. But
yeah, all of our tendency, the first thing is you want to just crawl into fetal position and lie down when a complication happens, and then deny that it happened. You don't want to go look at that perforation, but that's the point where you have to just calm yourself and think of the patient and talk to the patients because they appreciate you being there and being open, honest with them, and just as importantly, talk to the family members who have been out in the waiting room. They may not have seen you very long, but you want the family member to know that you're concerned, which you are, and you want to address your concern and not feel like you have to hide from the family member. People know that what you're doing has some risk to it, and you don't have to feel that that you did something wrong or guilty. It's the nature of what we do and how we practice.
Yeah. Switching gears a little bit, I feel like even within GI, there are just so many subspecialties and subspecialties. What is your advice to fellows who are just starting out in picking what their subspecialty should be, and how do you know which subspecialty is right for you?
Funny that Peter's asking the question. When Peter started with us, he did not want to hear about Barrett's esophagus. He didn't want to hear about colon polyps. It was pancreas, pancreas, pancreas. And I don't know where someone got you hooked on pancreas, but during regular fellowship, try to explore every field and stay open. And something will grab you. It may not have anything to do with the disease itself. It may be the patient you took care of. It may be your mentor. It may be something about the physiology. It may be something about the procedure. But if you keep an open mind, we all end up with forks in the road, and we don't know why we go in one direction or another. It's just something will happen, and you'll turn in your direction, and you'll find your calling. That's what this whole journey is about. Mm-hmm. God, you're getting philosophical.
Lastly, as someone who's written a lot of grants and won a lot of grants, what is your advice to maybe residents, fellows who are not really thinking about writing grants at that point in their career? Can you just tell us a little bit about familiarizing themselves with grants at an earlier stage, and why is it so important?
Yeah, when I was a trainee, I swore I would never write a grant because I saw my attendings groaning and moaning and going through this grant writing process, and it seemed like something that you never wanted to get into. But if you have an idea and you want to pursue it, the best way to do it is to go through the pain and the trial of organizing it and putting it on paper. And the grant writing process is an iterative process that forces you to think. So you have to figure out, it's simple to say, but figuring out what a hypothesis is not that easy. It takes days to figure out what a clear, specific hypothesis is. And then figuring out what your aim is. And that process is a thinking process that makes you more critical. It makes you go read the literature. It makes you understand the background. And it really defines the question that you can answer. Once you've done that, then putting together the preliminary data, thinking through all the steps of how that process works, and then applying for a grant, it is an invaluable lesson in figuring out how to answer a question. And then the most important advice is persistence, persistence, persistence. You have to write. You have to also be ready for a rejection, because the first grant you write, you think it's the best thing you've ever written, and the reviewers won't agree. And when that rejection comes back, you have to be willing to get up and fight harder. It's like Robert Bruce, fall down 8 times, but the 9th time you'll be able to get up and win. And when you get that grant, it does give you some power to do what you want to do.
Thank you, Dr. Chak, for your time. It was an invaluable time to learn different principles as we pursue a career in academic medicine. This is Peter Lee, mentee of Dr. Chak.